This morning, as we continue our series, Skinny America, eating disorders are not only confined to women, they're now seen in a growing number of young men. When Christian Bale took on the role of a chronic insomniac in The Machinist, he dropped over 60 pounds in a matter of months.
Don't I look okay?
If you were any thinner, you wouldn't exist.
But even though Bale's emaciated frame was created for a movie, the self-starvation he endured to achieve it is part of an alarming trend among young men. A 2007 Harvard University study showed that 25% of people with anorexia or bulimia were men, confirming that men are more susceptible to eating disorders than previously thought.
Looks have become important not only in the mating ritual, but in all aspects of society. Not only does the man have to get and keep the girl, but he has to get and keep the job.
Images of the perfect male physique are inescapable, and many men will stop at nothing to replicate what they see. Some develop an unhealthy obsession with exercise while dangerously restricting their calorie intake.
All of the fancy photographs of men that we see in magazines and in the movies and in advertisements make men feel very insecure, just the way they make women feel insecure. They are setting standards for what we are all supposed to look like.
And Hollywood is not immune to the pressure. Stars like Billy Bob Thornton and Dennis Quaid have both admitted to having eating disorders, raising the profile of a condition that many healthcare providers still know very little about. Joining us this morning, Dr. Ted Weltzine, Director of Eating Disorder Services at Rogers Memorial Hospital in Wisconsin, and Gary Grahl, who documented his personal struggle in his book, Skinny Boy. Good morning to you both.
Morning.
Gary, let me begin with you. Briefly describe your struggle with anorexia.
Well, I grew up an athlete in a small town in Wisconsin, and I put on this high expectation of I had these high expectations of myself to perform. And over time, with all my exercising and my dieting began, I became obsessed with routines and weight. My weight plummeted to 102 3/4 pounds in a matter of months. Wake up at 3:30 in the morning to exercise for 3-4 hours a day, and then after school and whatnot. But I was this all-American boy trying to achieve.
How long did this go on for?
This went on for a number of years. I was eventually hospitalized 6 times between 1984 and 1989. And with the help of some wonderful therapists and a team of physicians and doctors and nurses, and I also put in a lot of hard work, and I had to develop a lifestyle change to overcome it.
Dr. Weltzine, there are differences between men and women who suffer this disease and how it manifests itself. Can you describe it?
Yeah, Julie, I mean, you're right. The symptoms look pretty similar in terms of anorexia and bulimia, with obviously restricting and, as Gary said, low weight, and in the case of bulimia, binge eating and then purging. But the underlying issues are oftentimes very, very different in terms of the self-esteem issues for men. Typically, one issue that tends to come up a lot is people who have been teased, have been overweight as young boys, and then teased, athleticism, and trying to achieve more improved performance, and then also chemical dependency and substance abuse or alcoholism tends to also kind of set the stage for an eating disorder developing.
Whereas with girls?
Well, with girls, it has to do more with expectations and fears of becoming overweight and trying to avoid a situation that they see as not going to be a helpful situation. So women will typically get into eating disorders to avoid or have the fear of becoming overweight, as opposed to men who may have been overweight.
Is the way it's treated in boys versus girls the same?
No, it's not true. I mean, because the issues are different, and I think, as Gary said, the emotional issues, the treatment really needs to focus in on those specific emotional factors for men. And they're not the same as women, as you can imagine.
Gary Grahl, Dr. Ted Weltzine, thank you both for talking about this delicate issue.
You're welcome.
Thank you.